Community members that typically come into the space are a lot of times individuals who need support, but they don't know exactly how to access it. This can range from individuals who are needing support with job security, sometimes housing insecurity. It could be issues in finding programs or ways to get support for bill payments, SNAP, all sorts of things, as well as individuals who are experiencing a temporary change in their life. For individuals who might need a little bit more support than just some consultation in the moment, we do offer comprehensive crisis assessment run by clinicians, where they will assess all of your needs, focus on risk factors, and then work collaboratively with you to get you linked to whatever services will best fit your needs. And that could range anywhere from involvement in outpatient therapeutic programming to psychiatric services, as well as potentially Rosecrance's intensive community-based supports, all the way up to enrolling in our crisis residential program. Our crisis residential program also operates out of Rosecrance's Mulberry site, where it's up to a 14-day length of stay, where clients will interact with a psychiatrist within about 24 hours of admission, and they receive comprehensive intensive services pretty much the entire day during their stay. The clients we admit to our crisis residential program largely are either suicidal with an intent and plan, potentially. We're able to restrict means, and we're able to act as a psychiatric deflection center where they can work with us. Or a lot of times we also get clients who are experiencing psychosis, whether it's first episode psychosis and they don't quite understand the diagnosis, they don't understand their symptoms yet, and they just need that level of support. Or it's sometimes people fall off their medications and they need support getting re-engaged. The whole point of the crisis residential is to just get people back on their feet, give them the tools to be successful, and do warm handoffs to the next level of care. One of the common things we see at our Rosecrance Mulberry locations is individuals coming to us with a complex set of needs. So they may be living with depression, or they may be living with psychosis or severe trauma, but they might be coping primarily with the use of substances, which is not uncommon, unfortunately. The System of Care grant allows us to coordinate really quickly and collaboratively with our detox program over at Harrison. The expansion of our ability to take on even unfunded clients through our detox program for Winnebago community members has been greatly helpful in us quickly getting a client who walked in or was dropped off by a first responder. We can assess them at the Mulberry location with our medical staff to determine the best level of care, and then quickly get them into detox programming. And then the collaboration continues even once they're in detox programming. We continually staff these clients because a lot of times once they're detoxed off their substance use, they still need that mental health support to learn coping skills so they don't turn back to substance use as their primary coping mechanism.
The primary treatment goal is always safety, emotional and psychiatric stabilization, but specifically for this client, we wanted to improve their coping skills, reduce their risk of self-harm, and increase their medication adherence. This client was using substances to ultimately treat their own mental health disorders because they had a lack of access to their medications. So if we only address one aspect without addressing the other, we would have limited this client's progress. Integrating treatment allowed the team to address underlying depression, suicidal ideations, and other substance use patterns that were simultaneously inhibiting their full recovery at that time. So during this client's 14-day stabilization period, the client remained engaged and cooperative in treatment. They attended most groups with good participation. They met with the psychiatric providers such as myself. They received medication adjustments and support stabilization. They also met with PATH and other members of our Rosecrance team, and they chose on their own to put themselves on the Rosecrance Harrison campus location, which means they were already ready for change at that particular time in their life. And so it just allowed us to aid this individual, right? We did not have to kind of help them get to that stage. We just helped to aid them in their journey. This client's journey highlighted how important it is to have multiple levels of care working together. They enter treatment during a significantly vulnerable part of their life, including housing instability, mental health symptoms, and substance use. But through coordinated services, we were able to stabilize, reconnect with recovery goals, and transition them into ongoing treatment. Having a full continuity of care creates opportunities for people to continue to move forward instead of falling through the gaps in the system. I think these type of services are very important because there is a shortage, number one, of providers. There is a lack of access, especially to mental health providers, and people need immediate stabilization. Sometimes ERs are overcrowded, and sometimes the hospitals are overcrowded where clients are discharged way before they should be. And so I think Mulberry helps to reduce those unnecessary hospitalizations or provide support after those short-term care, because you only get about 5 to 7 days in the hospital, but sometimes that's not enough, especially when we talk about depression, because those medications take several weeks to kick in. So I think Mulberry adds an extra layer of protection in that. I think that having access to these resources and just knowledge of what's available to them helps clients kind of, when they're ready to make the change stage in their recovery, they don't have to waste time wondering where do I go or feeling defeated because they don't know what to do. They know where they can go and they know what services are going to be available to them so that it can make the transition for them a lot easier so that they don't have to add an extra step in their recovery process.
The Access to Care grant at the Rosecrance Mulberry location allows us to take on a wide variety of clients that without it we may not be able to take on. The ability for us to provide immediate access to medical staff as well as near immediate access to psychiatric staff allows us to be much more successful taking on clients experiencing psychosis, severe depression, or to even allow us to take on clients with some medical issues that we would otherwise not be able to take on. The last thing we want to do is have somebody who's ready for services today to then have to send them to another provider to get checked out to then hope they come back, because once again that offers that opportunity for them to talk themselves out. Whereas with the Access to Care grant, we're able to manage a lot more of that in-house, and we can be much more successful partnering with the programs that want to drop clients off to us for our care.
This client, when they presented at the crisis residential, had never had an experience of any kind of mental health crisis. This was new to them and their family. They were not sure where to go, who to ask what was happening. They were struggling with their family dynamics. They were struggling with their day-to-day just activities of daily living and performing those. They were having such extreme anxiety that they could not even rest. They were pacing constantly because they were in such a mental health crisis. We knew they needed stabilization with medications, with group therapy, and all the programs that Crisis Residential provides. This client was assessed by a clinician. Then they were assessed by our medical team. The psychiatrist started them on oral medication for the next 14 days. The client did very well on this medication. At the end of 14 days, with this patient being at Mulberry Crisis Residential, after many group sessions, individual sessions, discharge planning with multiple different disciplines, they were made an appointment with a psychiatrist to continue care at the Rosecrance Mulberry Center. They continued their long-acting psychotropic injectable. They had a fear of being non-compliant with oral medications, and this put them at great ease, knowing they get it once a month if they don't have to worry about taking a pill every single day. And they also see the psychiatrist often here. to help change doses or manage any other kind of medications that they're on. The Rosecrance Access to Care program is super beneficial for us to continue ongoing treatment for the patients that we have stabilized but still need ongoing care to maintain that stabilization. We want them to be successful where they are in life, and the Access to Care program allows us to do that. So the importance of the programs supported by the Winnebago County Community Mental Health Board have allowed us to have flexibility on the way that we treat clients who come to us in mental health crisis. We want to be able to take anybody at any time, regardless of their financial status, their home life status. We want to just get them in, get them stabilized, get the treatment they want and need and deserve.